Hi, my name is Bob Schlieder. I am the business owner for the modernization effort, and I have the primary responsibility for prioritizing and decomposing our target business outcomes for the team. I will be walking through the outcomes we've prioritized as a starting point for our effort and provide examples of the pain points and improvement ideas we've received from our providers as the top priority items. As you've heard from Liz in the introduction video, we are launching our modernization efforts with an initial focus on provider enrollment, credentialing, re-enrollment, and provider information maintenance. The provider enrollment process is the entry point for providers wishing to serve Medicaid members and can be leveraged to enforce data quality standards and rules. Our current systems provide little in the way of structured data entry and do not enforce even basic data integrity relationships. For example, our system has a name field which is used to capture first name, last name, organization name, really anything you want to enter into a single open text field if you can believe that. Modernizing the enrollment process will set the path for collecting and maintaining clean, organized data from our providers. For the provider enrollment outcome, we've defined 2 success criteria for assessing how well we've achieved the desired result. 1, reduce the effort required from providers to complete the enrollment process from start to finish. And 2, reduce the elapsed time it takes providers to complete the enrollment process from start to finish. Both success criteria consider the entire process, which includes any steps providers must take to become credentialed with managed care payers. However, since we prioritize the improvement of our provider data quality, we plan to focus initially on the Iowa Medicaid enrollment portion of the process. To understand our baseline performance against these success criteria, we ask providers to estimate the amount of effort they spend going through the enrollment process and pulled processing time data from our enrollment application processing system. We found on average that providers spend 5.5 hours getting enrolled with Medicaid and 6.2 hours completing the credentialing process with managed care payers. On average, over the past 3 years, the enrollment process takes 40 days from application submission to approval. Credentialing process times average around 8 days over the past year, not including the time required to establish contracts. Keep in mind these are aggregate metrics across all provider types and scenarios. Please reference the Medicaid Modernization website for access to the full baselining dashboard showing provider enrollment volumes and the baselining metrics broken down by provider type. To determine solution ideas most likely to improve these 2 success criteria, we held listening sessions with providers. Here are some of the feedback points we captured. 1. Improve the application process and information available to providers about how to enroll. Our current enrollment form was designed to be universal, which means all information and data fields are presented for all provider types. Really, a subset of the application is relevant to each provider, and the application also must be manually filled out and emailed, mailed, or faxed to us. Providers do not have a visibility into the status of their application and often end up calling provider services to determine where they are at in the process. With an automated solution, we can easily create an online wizard-style process that clearly lays out exactly what is needed from the provider based on their provider type and ask them only for information we need to process their particular application. We can also give providers the ability to look up status of their application, to understand where they stand in the process, as well as notify them automatically when action is needed or when status changes occur. 2. Take advantage of automation opportunities. In many cases, providers provide insufficient or incorrect information with their application, resulting in delays while our staff request corrections and supplemental information. We can automate validations and lookups to save providers time when applying and prevent back and forth with staff. A third area was to integrate Medicaid enrollment with other payer enrollment to streamline the process. Providers must currently provide the same duplicate information to NPES, Iowa Medicaid, and each payer they want to credential with. A new solution could reduce provider effort by retrieving and/or passing on information provided to other payers where possible. There are also several internal factors we must consider in pursuit of this outcome and our goal of improving provider data quality. In our current systems, we did not establish a guaranteed method of identifying a provider between systems. We believe the standardization and implementation of a provider identification system is needed in our new solution. Further exacerbating our data quality issues, even if we can match provider records between systems, there is no standardization between how Iowa Medicaid captures taxonomy or service information from providers and how the MCOs capture it. The same provider may be given different options to select when applying in each system, creating discrepancies. We believe standardization is also required for taxonomy and service types as part of the modernization effort. We anticipate both of these standardization activities to require coordination and crosswalking back to our existing data to ensure we don't negatively impact business continuity on our existing systems. Our analysis indicates it will be unlikely we can easily change reference data values in the current state systems without refactoring those systems. Lastly, in the cases in which staff intervention is required, a clear, easy-to-use, and easy-to-track process is needed to ensure staff can manage their enrollment workload and quickly take action to complete any manual steps required. In alignment with the New Elephant approach that Kevin and Stephanie described earlier, we have been working to identify a first category of providers with whom we can partner as we launch our first modernization initiative. We've decided to begin with our physician population and have captured the current state process steps and business rules applicable to physician providers. Additionally, we've established a work group of providers who are engaged and excited to work with the delivery team on the best methods of achieving our provider enrollment outcomes. I'm looking forward to launching this initiative.
Liz here again. I can't agree more with Bob on how excited we are to begin our modernization effort. I'd like to talk a bit about our next steps, which include beginning our engagement with the vendor community, who we hope can bring us innovative solutions and highly skilled practitioners to start raising our new elephant the right way. We recognize we are not experts in modern technology or the latest software integration and development practices that optimize flexibility, adaptability, quality, and the successful delivery of business outcomes. We also recognize the complexity and unknowns present in our current state environment, which limit the ability of outside experts to confidently recommend solutions. We have the following activities planned to reduce both of these current knowledge gaps. First, publishing our modernization website, including questions and answers from vendors and a documentation library. Second, issuing a request for information seeking solution suggestions from the vendor community that are best suited to deliver our outcomes. And third, holding vendor conferences to facilitate an open, collaborative exchange of information with the vendor community. We hope we can quickly achieve the knowledge required to move forward with our first delivery initiative. I'm looking forward to it.
We are excited to launch this modernization initiative and see the outcomes from our upcoming collaboration and innovation. I love the idea of raising a new elephant as quickly and responsibly as we can. Liz and her team have my full trust and support, and I can't wait to see our results.